The Ministry of Health, in collaboration with the National AIDS Secretariat and partners, commemorated World AIDS Day at the Governor's Office in Brikama on the theme Let Communities Lead. This celebration is held every year as December 1st is meant to raise the awareness in combating HIV and AIDS. However, the Ministry of Health and its partners celebrated the day on the 16th of December 2023. The commemoration also showed the launch of the 2022 UN AIDS Global Reports. Speaking at the ceremony, the Deputy Governor of West Coast Region, Baba Galde Jallo, who spoke on behalf of the governor, said this day is a milestone to their quest to fight against HIV and AIDS. Jallo also said their institution is playing their role to raise awareness of HIV and AIDS and how to reduce the incident in their community and as well as schools. Ms. Adama Drame, Director of National AIDS Secretariat, said they are fortunate to have effective treatments for HIV, but despite these advancements, new infections continue to occur due to the lack of awareness, mainly fueled by stigma and discrimination against the people living with HIV. She assured their Secretariat willingness to work with the Ministry of Health in combating HIV and AIDS.
Successful HIV responses demand robust political leadership, addressing inequalities, involving commitments, communities, organizations, and ensuring sustainable funding. It is pleasing to learn that countries like Botswana, Rwanda, the United Republic of Tanzania, and Zimbabwe have achieved their 95-95-95 targets, with at least 16 other countries approaching within this milestone. The Secretariat will work closely with the Ministry of Health and stakeholders, stepping up our engagement with communities and recognizing their instrumental role in ensuring an effective response to HIV and AIDS.
Mamadou Tinyasi, Deputy Director of Health Services, who gave a keynote address on behalf of the Minister of Health, said HIV prevalence in the country remained low at 1.9% and 1.52% according to Demographic Health Survey 2013 and the National Sentinel Study 2020 respectively.
The government of the Gambia remains committed to the creation of an enabling environment through concrete action and policies that will facilitate strengthening of the gains made in the national response. In 2023, UNAIDS estimated that 26,068 people are living with HIV in 2020 in the Gambia. Only 14,717, that is 56%, know their HIV status. Of those who know their status, 9,554, that is 65%, were receiving treatment. The country therefore needs to redouble its effort in improving access to testing and treatment and also addressing stigma and discrimination as well as they continue to be compounded factors to the utilization of HIV/AIDS.
The UNAIDS Country Director Sira Horijandau said that the world is committed to end AIDS pandemic by 2030 as part of the targets in the Sustainable Development Goals, and ending AIDS requires them to prioritize communities.
We are at a pivotal moment, and ending AIDS required us to prioritize communities and fully fund their leadership roles. The UN system stands in solidarity with communities worldwide, calling for communities' leadership roles to be central in all HIV plans and programs. Community leadership roles to be fully and reliably funded, and the removal of barriers to communities' leadership roles. Together, we can make the path that ends AIDS by 2030 a reality, but only if we let communities lead.
A day dedicated to supporting those living with HIV and AIDS-related illness witnessed the launch of the 2022 UNAIDS Global Reports entitled Let the Community Lead by the Chief of Staff Maud K. Cisse, who who was represented the First Lady Fatmata Babaru. The day ended with a drama by the Red Cross volunteers who portrayed the need to know one's HIV status and how to live with the affected people in the community. Other speakers include Executive Director of Action Aid International, among others, who stressed the need to double their effort to end HIV and AIDS. Reporting for N24 TV, I am Fatubi Kamara.